The federal government today announced the first steps toward regulating e-cigarettes. They're growing in popularity, especially among those trying to quit traditional cigarettes. FDA says it needs to know much more about the risks, and so far they say they don't know much. Our report tonight from NBC's Tom Costello.
They're springing up all over the country, so-called vapor bars catering to e-cigarette customers, many trying to wean themselves off tobacco. In Los Angeles, the liquid nicotine business is booming.
Well, it's water vapor, so it's really light tasting.
Right now, I have green tea lemonade, and I have a flavor called Sancho, which is like a pineapple peach.
Fueled by a massive marketing campaign.
I've been a smoker for 20 years, and I just found the smarter alternative.
E-cig sales have taken off, $2 billion last year and growing. Now, for the first time, the FDA is preparing to regulate e-cigarettes much as it regulates tobacco, prohibiting sales to minors, free sample handouts, and vending machine sales, requiring manufacturers to provide a full list of the chemical ingredients and nicotine warning labels.
We don't know as much about the health and safety risks of e-cigarettes, and that's why we want to be able to regulate them so that we can get the information we need about what's in them.
The e-cigarette industry says with 250 different brands on the market, regulation is a must, ultimately providing the end user with a product that is consistent. Unlike traditional cigarettes, e-cigarette makers will still be allowed to advertise on TV. And for now, the FDA will permit the sale of flavored varieties, which many consumer advocates insist are only meant to attract young people, a charge the industry denies. Meanwhile, health experts also worry that highly addictive nicotine still isn't regulated.
There are some of these products that deliver a very high content of nicotine, far, far higher than smoking several cigarettes.
It's the vapor clouds themselves that have led many cities to ban e-cigs in public buildings as the vaping fad spreads.
The concern is that there are chemicals in those vapors which could be toxic to the person inhaling or people nearby. The FDA is hoping that by knowing what the chemicals are, it will learn whether they're harmful. Brian?
Tom Costello out of Washington for us tonight on this story. Tom, thanks.